Shoulder pain can be uncomfortable, inconvenient, even debilitating. But what if baseball is your passion? A shoulder injury can be a career ender.
It was making me pretty much miserable. When you can't do the things that you like to do and it's inhibited because of pain, it makes it pretty bad.
That's what John Kostriva faced every time he threw a ball. What's more, as the varsity coach at Northville High School, baseball was an integral part of his livelihood.
A baseball player's arm is everything to him, and once it goes, it can be very mentally challenging.
John joins me to talk about his medical journey and his triumph over a serious shoulder injury with the help of sports medicine specialist and board-certified orthopedic surgeon, Dr. Mark Millia. How'd you get started in baseball, and then how'd you get to be a coach?
I started playing baseball when I was 3 or 4 years old, played through high school, played collegiately. And, once my collegiate career was over, I became a physical education teacher here at Northville High School. I had never had a shoulder problem before in my life up to that point. And once I had elbow surgery, I didn't feel a whole lot of elbow pain even through my collegiate career, but my shoulder hurt all the time, constantly. Day after day, it was Motrin, it was therapy, it was trainers, it was ice, it was everything, and it just never got better. At that point in time, I started getting into coaching and throwing up to 200 pitches or more of batting practice a day is very taxing on the arm. So it kind of continued to get steadily worse and worse. In talking to Dr. Millia, because he was an athlete, he could understand. I think if I went to a lot of doctors, they would say, just don't throw as much, or maybe you ought to hang him up now because you're getting a little older. He was always trying to help me because he knew how much it meant to me, not only to be able to coach comfortably, but to still be able to play the game that I truly have a passion for and truly love.
John had a very unusual problem, actually. He had something called a thrower's exostosis, which in 7 years of practice and seeing about 7,000 patients, he's only one of 2 I've had. I was lucky I actually figured it out because it's not that common. And it's basically a bone spur that forms in the back of the shoulder in people who throw a lot. And so the treatment for it was just get rid of the spur and release the tight ligaments in the back of his shoulder, and it appears to have worked.
And about how much rehab did he have to face to get back to normal?
He likely had to work at least 3 days a week with a shoulder therapist just to get to the point where he could throw, and that would take about 3 months of therapy and then about 3 months of regaining the ability to throw. And so it's usually a 6-month recovery before you can get back into competitive baseball.
6 to 8 months later, I was playing summer ball again, and I was actually I'm 38, at 36, I was throwing as hard or harder with no pain in my shoulder for the first time than when I was 19 years old.
It must have meant a lot to you to have Dr. Millia's sports medicine background as well as the surgical skill to do what you needed to get back to the sport you love?
Yeah, because we had a pretty good rapport, and he was very, very accessible. I could call him on the phone, I could text him, let him know what was going on, and the wait in terms of getting in to see him wasn't very lengthy.
I know he's a very active guy, and he really likes to maintain his interest in sports and whatnot. He's very competitive, and I'm glad that he's gotten everything back. It makes me very happy.